Yeah, Joyce, it is. So it depends on which pharmacy you go to. I did speak with the State Department of Health today, who told me that the state supply of the Johnson & Johnson vaccine is greater than the number that's been requested recently from providers. But for pharmacies that get their supply from the federal government, that supply is stretched pretty thin. As October 18th approaches, some healthcare, education, and state employees hesitant to get the COVID-19 vaccine are now coming up on the deadline.
Because October 4th is the last date to get Johnson & Johnson and qualify as fully vaccinated.
According to the State Department of Health, there is an adequate supply of the Johnson & Johnson vaccine. As of September 20th, the state has more than 84,000 doses, and nearly 60,000 have been requested from providers in the last round of orders. But the availability at the state level was just mended after a month of frustration for vaccine providers.
Mostly all of August and early into September, there was none available within the state. And current supplies were expiring and they were reaching their expiration date. So fortunately, there was vaccine made available. And now
Steve Fialka, Chief Pharmacy Officer for UW Medicine, says all their pharmacies have the supply needed for now, but he's anticipating the demand to grow.
We expect as this date gets closer, more individuals will probably, have to make a decision, and J&J probably will be their choice.
But for companies that rely on the federal government for vaccine doses, it's a different story.
Our teams are getting bombarded with calls, and it's been an issue because we can't get it.
That's David Green, the director of pharmacy for Safeway and Albertsons in Seattle. He says Safeway and Albertsons get their vaccine shipments from the feds, and there's a backlog in supply.
We're at the mercy of the federal government in terms of ordering our Johnson & Johnson, and we're just not able to get any in. So we've got just a very, very small amount.
Green says there's no way for them to predict when more doses will be available. So both Green and Fialka say that one thing is clear: if you're under the mandate and you're still waiting to get your vaccine and you're choosing to, do not wait until October 4th and just hope that there's a dose of Johnson & Johnson available. They say that of course, demand is expected to continue to grow as we approach the deadline. Live in Seattle, Kayla Lafferty, King 5 News.